Did you know that prostate cancer ranks among the most prevalent tumors affecting men globally? Despite its widespread occurrence, many individuals tend to overlook the subtle signs that may signal the onset of this disease. Today, we will explore the early symptoms that should never be dismissed, the key risk factors, and the preventive measures that every man ought to be aware of. Stay with us until the end to discover how to identify potential changes in your body and ensure timely treatment when needed. The prostate, a small yet vital gland, plays a crucial role in men's health. The male reproductive system is situated beneath the bladder and in front of the rectum, serving a crucial function in generating a portion of the fluid that constitutes semen, which aids in nourishing and safeguarding sperm. However, any disruption within this gland, whether from inflammation like prostatitis or the development of abnormal cells, can lead to significant health issues. Prostate cancer arises when prostate cells undergo mutations and proliferate uncontrollably, potentially resulting in a tumor. In many instances, it progresses slowly, but in some cases, it can become aggressive, spreading to other areas of the body. Understanding the function and location of the prostate is vital for recognizing potential warning signs early. The significance of early diagnosis cannot be overstated. It is the foundation in the battle against prostate cancer. In its early stages, the disease may not show obvious symptoms, leading many men to remain unaware of its presence. This highlights the necessity of routine screenings, such as the PSA, prostate-specific antigen, test and the digital rectal exam. When prostate cancer is detected early, the chances of successful treatment increase significantly, and therapeutic approaches tend to be less invasive during the initial stages. Unfortunately, the stigma and fear surrounding the digital rectal exam deter many men from seeking medical evaluation. It's vital to prioritize health over cultural barriers or prejudices, as doing so can save lives. Several risk factors are associated with prostate cancer, including age. Men over 50 have a significantly higher risk, although cases. Early onset prostate cancer can be influenced by family history. If a father or brother has had the disease, the likelihood of developing it increases significantly. Additionally, race plays a role, as black men statistically face a higher risk of developing prostate tumors compared to men of other ethnicities. Lifestyle factors such as diets rich in animal fats, physical inactivity, and excess weight can contribute to the onset and progression of cancerous cells. It is often advised to maintain a healthy diet and regular exercise routine to mitigate these risks. Early symptoms of prostate cancer can manifest in various ways, and one of the initial signs that men may observe is a change in their urinary flow. You might find it challenging to initiate urination, experience a weaker stream, or encounter interruptions while emptying your bladder. Additionally, a lingering feeling of incomplete bladder emptying may arise, leading to discomfort and anxiety. While these symptoms are frequently associated with a benign condition known as prostatic hyperplasia, they can also signal the early stages of prostate cancer. If you notice any alterations in your urinary habits, it's important to pay attention. Patterns indicate the need for medical evaluation promptly due to increased nighttime urination frequency, which involves waking up several times during the night to urinate, known as nocturia. This symptom is often overlooked by many men and can stem from various conditions, including infections, poorly controlled diabetes, or prostate enlargement. An enlarged prostate exerts pressure on the bladder, triggering frequent urges to urinate. Interrupted sleep can lead to fatigue and irritability, ultimately affecting overall quality of life. While this may appear to be a normal aspect of aging, worsening symptoms should not be ignored. The presence of blood in urine or semen is a concerning symptom that warrants immediate attention from a healthcare professional. Blood in urine, known as hematuria, or blood in semen, referred to as hemospermia, should never be overlooked. These alarming signs can stem from various conditions, including urinary infections or kidney stones. However, when associated with the prostate, they may suggest the presence of tumor lesions. This symptom is often observed in more advanced stages of prostate cancer, though individual cases can differ. If you observe blood and bodily fluids, it is crucial to seek medical evaluation without delay. Laboratory analyses and occasionally a biopsy may be essential to identify the cause. Preventive measures and future steps are vital, as prostate cancer can pose serious risks. However, early detection and proactive actions can significantly impact outcomes. Here are some practical suggestions. Arrange for regular screenings. Annual PSA tests and digital rectal exams are critical, particularly for men over 50 or those with a family history of the illness. Embrace a nutritious diet that emphasizes fresh fruits, vegetables, whole grains, and lean proteins while reducing red meat intake. Meat and processed foods should be consumed mindfully, while regular exercise plays a crucial role in maintaining a healthy weight, enhancing circulation, and lowering overall cancer risk. It's important to listen to your body and not overlook subtle changes. Early symptoms can often be managed effectively if addressed promptly. In conclusion, prostate cancer poses a significant health challenge, but being aware and taking proactive measures can greatly improve outcomes. By recognizing early symptoms, understanding your risk factors, and dedicating yourself to preventive care, you can take charge of your health and well-being. Your health should always come first. Don't allow fear or stigma to hold you back from getting the care you deserve. Stay proactive, consult your doctor regularly, and equip yourself with the knowledge necessary to safeguard your well-being. Remember, taking action early can be life-saving. It's crucial to recognize the signs of prostate cancer, a serious health issue affecting men globally. While some symptoms may be mild, they must not be overlooked. Early detection is key to achieving effective treatment and improving outcomes. This guide aims to assist you in recognizing important warning signs and emphasizes the significance of obtaining prompt medical attention. Symptom 4. Pelvic pain or discomfort. Pelvic pain is frequently linked to inflammation or muscular problems, yet this area houses essential organs, including the prostate. Ongoing sensations of intense discomfort or sharp pain in the lower abdomen, lower back, or genital region could indicate tumor development. This discomfort may also extend to the back, complicating daily activities such as walking or sitting. Extended periods can be challenging in the advanced stages of prostate cancer, and this pain may become constant. Many patients mistake it for muscle strain, which can delay medical evaluation. Persistent pelvic or lower back pain should never be underestimated, as it could indicate a more serious condition. Another symptom to consider is changes in ejaculation. Prostate cancer can directly impact the processes involved in producing seminal fluid and releasing sperm. Men may notice reduced semen volume or experience pain during ejaculation, and while such changes are often misidentified as infections, persistent symptoms warrant careful consideration. Tumors that compress adjacent structures can disrupt the function of the ducts responsible for semen transport, leading to alterations in texture, color, or fluid quantity. If these symptoms linger for weeks or intensify, seeking a professional evaluation becomes essential. Many cases of prostate cancer are identified at this juncture, frequently before more prominent urinary symptoms manifest. Another symptom to note is difficulty maintaining an erection. Erectile dysfunction can stem from various factors, including diabetes. Circulatory issues and side effects from medications can be significant, yet alterations in the prostate gland may also contribute. The growth of tumor cells can interfere with blood flow to the corpora cavernosa of the penis, hindering the ability to sustain erections. If erectile dysfunction arises suddenly or deteriorates over time, it is crucial to delve deeper. A straightforward urological examination can reveal whether the underlying cause is linked to prostate cancer or another condition. Early intervention enhances quality of life and guarantees effective management of any underlying concerns. Experiencing a sensation of bladder pressure, particularly the feeling of a full bladder even after urination, is a frequent issue for men dealing with prostate concerns. This symptom typically arises when an enlarged prostate causes a partial blockage, hindering the complete emptying of the bladder. The presence of residual urine can lead to discomfort and may compel men to exert their abdominal muscles during urination, worsening the situation. If not addressed, this condition could lead to complications, including recurrent urinary infections due to the retained urine. Encourages bacterial growth if bladder pressure continues. It is advisable to consult a specialist and undergo imaging and laboratory tests. Symptom 8. Unexplained weight loss. Sudden, unintentional weight loss serves as a warning sign often linked to various cancers, including prostate cancer, especially in advanced stages. Tumors can induce metabolic changes and a decrease in appetite, resulting in considerable weight loss. This symptom may also present with fatigue, paleness, and weakness. If you observe changes in your clothing fit, experiencing looser fitting clothes and a decrease in appetite without an obvious cause warrants a medical evaluation. While weight loss can stem from various health conditions such as hyperthyroidism or gastrointestinal disorders, a comprehensive investigation is crucial to eliminate serious concerns, including cancer. Another symptom to note is fatigue and ongoing tiredness. Constant fatigue that lingers even during everyday tasks is a vague yet telling sign, as tumor growth can significantly divert energy within the body to address the issue. A condition that results in metabolic alterations can impede nutrient absorption and tissue oxygenation, leading to chronic fatigue that significantly affects productivity, mood, and overall quality of life. If you observe a notable drop in energy levels without any changes in habits or increased stress, it's essential to consider prostate health as a possible factor. Ongoing fatigue, especially when accompanied by other symptoms, necessitates timely medical evaluation. Regular examinations play a crucial role in identifying prostate cancer, with two specific tests being particularly important: the PSA. The prostate-specific antigen test and the digital rectal exam are essential components of prostate health assessment. The PSA test measures the levels of a protein produced by the prostate. Elevated levels may not always indicate cancer, but significantly high values can raise concerns. The digital rectal exam allows the doctor to evaluate the texture, size, and shape of the prostate gland. Utilizing both tests enhances detection accuracy, and in certain situations, further imaging tests like a transrectal ultrasound or MRI may be necessary to confirm the diagnosis. Pay attention to the subtle signs, as prostate cancer can often advance without noticeable symptoms, making early detection vital. Symptoms such as pelvic pain, changes in ejaculation, erectile dysfunction, bladder pressure, unexplained weight loss, and persistent fatigue should never be dismissed. Regular screenings and timely medical evaluations serve as your strongest defense against this illness. If you encounter any of these symptoms or observe unexplained changes in your health, seek the advice of a specialist without delay. Your health should always come first. Awareness and prompt action can be life-saving. Enhancing quality of life and achieving successful treatment outcomes requires staying informed and being proactive about prostate cancer. This condition is among the most prevalent cancers affecting men, and comprehending its signs, risk factors, and treatment options can significantly impact results. Let us delve into the essential aspects of regular screenings, available treatment options, lifestyle modifications, and dismantling the stigmas surrounding men's health to promote early detection and improved outcomes. Regular examinations for men aged 50 and above are crucial. For those with risk factors, regular consultations with a specialist are essential. Routine evaluations, including the PSA, prostate-specific antigen, test and digital rectal exam, aid in the early detection of abnormalities. The frequency of these checkups should be discussed with a doctor based on individual risk factors. Once diagnostic tests and biopsies confirm the presence of malignant cells, determining the stage of the tumor becomes the next crucial step, allowing for tailored treatment plans. Open communication with healthcare providers is vital. During this challenging time, seeking second opinions is highly advisable. Various treatment options and their potential side effects should be carefully considered. The approach to prostate cancer treatment varies based on the cancer stage, aggressiveness, and the patient's overall health. Each method presents its own benefits and possible side effects. For instance, radical prostatectomy is a surgical procedure that removes the prostate gland and is commonly employed when the cancer is localized. While it can be effective, it may lead to side effects such as urinary incontinence and erectile dysfunction. Radiation therapy can be administered either externally or internally, specifically targeting tumor cells in the bronchi. Common side effects include fatigue and irritation of the bladder and rectum. Hormone therapy works by reducing testosterone levels, which helps slow tumor growth, but it may lead to hot flashes, loss of bone density, and decreased sexual desire. Chemotherapy is typically reserved for advanced-stage prostate cancer or cases that are resistant to other treatments. Side effects can vary but may include fatigue, nausea, and weakened immunity. Every treatment comes with its own set of risks, yet the success rates are encouraging when therapies are selected and delivered correctly. It is essential to focus on maintaining quality of life throughout and following treatment, as well as managing side effects. During prostate cancer treatment, several strategies can be beneficial. Engaging in physical exercise, participating in supervised activities, and undergoing pelvic physiotherapy can fortify the pelvic floor, leading to improved urinary control and reduced incontinence. Additionally, a balanced diet can enhance immunity, support recovery, and provide essential nourishment. The body requires essential nutrients, and psychological support from family, friends, or support groups can help lighten the emotional load. Seeking professional counseling can also be incredibly advantageous. Confronting prostate cancer is tough, but relying on loved ones and pursuing professional assistance can greatly reduce anxiety and fear. Additionally, a balanced diet is vital in preventing and managing prostate cancer. Consuming foods abundant in vitamins, antioxidants, and fiber, like fruits, vegetables, legumes, and whole grains, can be beneficial. Protecting oneself from free radicals and inflammation is crucial. However, an overindulgence in fatty red meats, processed foods, and ultra-processed snacks can lead to increased inflammation, heightening the risk of cancerous cell development. Embracing a Mediterranean-style diet, abundant in fish, olive oil, and vegetables, has demonstrated considerable advantages for men's health. Furthermore, moderate intake of soy products may positively affect hormonal balance. Beyond dietary choices, regular physical activity and weight management serve as vital strategies in the fight against cancer. Consistent physical activity bolsters the immune system, balances insulin levels, and diminishes chronic inflammation. On the other hand, a lack of movement encourages fat buildup, interferes with hormone production, and heightens the risk of mutations. Integrating enjoyable and feasible activities such as walking, swimming, or cycling into daily life, with professional oversight, guarantees both safety and effectiveness. Mental well-being is equally crucial. Elevated stress and anxiety can worsen inflammation, fostering a conducive environment for health issues. Tumor progression and stress management through mindfulness meditation can significantly enhance overall well-being. Breaking the taboos surrounding men's health is crucial, as the reluctance of some men to discuss health issues, particularly intimate ones, poses a significant barrier to early prostate cancer detection. Many avoid the digital rectal exam due to discomfort or embarrassment. However, this quick and vital procedure could save lives. Awareness campaigns aim to dismantle these taboos, encouraging participation in initiatives and fostering open discussions about symptoms with friends. Encouraging routine exams and open discussions about male health can help normalize these important conversations and facilitate early problem detection. Maintaining vigilance during and after treatment is essential for those undergoing or finishing their care. Regular follow-ups, including repeated blood tests, imaging scans, and consultations with doctors, are crucial. While this level of vigilance may induce some apprehension, it plays a vital role in ensuring that any recurrence or progression is identified promptly. The cure rates for prostate cancer are particularly promising, especially with early detection and ongoing advancements in treatment. Advancements in medical technology and treatment protocols enhance outcomes through a preventive mindset. If you notice unusual symptoms or have family risk factors, it's crucial to seek medical attention promptly. Knowledge, routine screenings, and a proactive approach serve as invaluable allies in the battle against prostate cancer. In conclusion, while prostate cancer presents a significant challenge, early detection, personalized treatment, and lifestyle adjustments can greatly improve outcomes. Maintaining a balanced diet, staying active, and prioritizing mental health are essential components of this journey. Are vital elements of prevention and recovery. Awareness and open communication are crucial. By dismantling taboos and embracing regular health checkups, men can protect their well-being. If you observe any symptoms or have concerns regarding your prostate health, consult a doctor promptly. Remember, early detection and timely treatment can save lives. Take charge of your health with confidence and proactivity. Disclaimer: this information is derived from trustworthy medical sources but does not substitute for professional healthcare advice. Always seek guidance from a qualified healthcare provider. Seek advice from a qualified medical professional for any concerns or symptoms.